In this video, we're going to go over a little bit of information about what I call not knee, runner's knee, as well as a combination test and treatment, and one exercise to help you out. So in parts 1 and 2 of this series, we went over 2 diagnoses that fall under the umbrella of runner's knee. In part 1, we went over Chondromalacia Patella, that's damage under the kneecap and the cartilage that sits below it. And in part 2, we went over patellofemoral pain syndrome or patellar tendinopathy. They're often linked, which is pain more in the squishy part below your kneecap, in between your kneecap and your shin bone. For this part, we're going to be talking about not knee, runner's knee. And not knee, runner's knee means that the pain is being sent to your knee, but the irritated structure is actually not in your knee. The classic example of this, called referred pain, is if somebody's having a heart attack, oftentimes they feel that their left arm is hurting, or their shoulder blade, or something like that, where it's not actually that anything's wrong with their left arm, but that pain from the heart muscle being damaged is referring itself elsewhere. The same concept can be applied here for the low back or hip and the knee. So nerves in your low back may be irritated for some reason and be sending pain to your knee. This is especially the case if you feel like it's been switching sides, if it's been there for months or even years, if it comes and goes, or you feel that it's kind of giving out without any popping or clicking. This can be a really frustrating diagnosis for some people because it doesn't show up on imaging. You won't see it on an MRI. You might get an MRI of your knee and it'll be completely clear. Same thing with X-ray or CT scan or anything like that, because that pain is actually coming from a structure that's not in your knee. So you're looking at the structure that hurts, but the reason that it hurts is actually not there at all. So what do you do with that? How do you know if you're actually in that category? We're gonna go over a combination test and treatment. With this, if it helps, you're likely in this category. And if it doesn't help, then you may be in a different category, maybe in parts 1 or 2 of this video. So for this combination test and treatment, go ahead and grab a seat or stand up. It's easier if you sit down. But we're going to be focusing on that area that hurts. For most people, it's going to be right in the inside kind of part of their kneecap here and maybe above. But we're going to be doing something called skin rolling or skin pulling. We've done it in a few other videos, but it works really, really well for not knee, runner's knee. So go ahead and take one hand. We're going to pinch the skin above where it hurts and lift it away from your body. By doing this, we're letting all the structures under it kind of glide and slide as they're supposed to, instead of being adhered to each other and creating some irritation here. And we're just going to work in that area where it hurts. If you find a hot spot here, for me it's like right here, find that hot spot, pull the skin away, and then go in and out with your knee. And you can work up here. Another common hot spot is right on the inside, kind of where your quad ends here. Again, pull the skin away, go in and out. Do this for about a minute. I wouldn't do it for much longer than that, and be sure not to bruise any of the skin around this area, but really make sure you're lifting that skin off. If that helped you, that is a really good indication that you're in this not knee, runner's knee category. And let's do one treatment that may really help you. So usually for this treatment, we use a door frame that I would hold on to, but for the purposes of this video, we're gonna be using this bench here. So this is a type of sloppy squat. We're gonna come over to the door frame or the bench, and you're gonna grab either the sides of the bench or the middle, ideally the middle. And if you're on a door frame, grab just the molding of it. So your hands are gonna be in like a little crimp position. If we're up here, we're gonna walk down such that we're in this sloppy squat here. You can notice that my low back looks like a shrimp. I am super rounded here, and that's intentional. Not only are we exposing the knee to a range that it may not be comfortable in with explosive load, like running, walking, or going up and down stairs, but we're also opening up all of these facet joints in the low back, which is often where those nerves that go to your knee get irritated. So we're gonna hang out here, try and breathe deep into your hip pockets, fill up the waistband. Let it out with each out breath. And you should be maybe feeling a little bit of work in the front of the shins, but ideally the only thing that's working is your hands gripping the bench or the door frame. If you feel a little bit of pinching in the front of your hip, go ahead and go knees out even more or pull yourself closer. The main point of this exercise, other than exposing the knee to this range, is getting this nice round in your back. So you can walk your hands even lower or up a little bit, as long as we're targeting rounding right here. Go ahead and do that funky squat for about 2 minutes. Take a short break and then go for 1 more minute. and get up and walk around, test out that knee and see if it feels any better. Not knee runner's knee is actually really common, especially in those chronic cases or cases where it's on both sides or switch sides. So if you think you're in this category, it's important that you see somebody who knows what that is. You can get all the imaging and everything that you want, but if nothing's coming up on that, we got to explore different routes and see what's actually going to help you. If you're interested in something like that and think you're in that category, go ahead and reach out to us. We do one-on-one visits both in person in Costa Mesa, California, and virtually. If you're not so sure about doing a one-on-one yet, we do have a knee webinar that may help you out. It has all of this information and much, much more about this diagnosis, as well as other knee-related, runner's knee-related diagnoses that should be popping up on the screen somewhere here.